So again, warm welcome everyone to this webinar. And our topic for today is global challenges and the future of health promotion. So the question there for us, what are the implications for us here in New Zealand, but also for our world community? And it's great to have Associate Professor Rachel Kumar and Dr. Briami Tutone as co-presenters with us here today. Planetary health as a topic for us to look at is quite important these days. And the Health Promotion Forum has a great concern, like many other public health organizations, about the well-being of the planet. And that's why we decided that we should examine this topic today. As you can see from the statement last year of the Secretary General of the United Nations, Antonio Guterres, the state of the planet, it's broken. We are facing a devastating pandemic, new heights of global heating, new lows of ecological degradation, new setbacks in our work towards global goals for more equitable, inclusive, and sustainable development. So in short, the planet is broken, and it's actually a pathway to suicide. The good news is that there's hope we can turn it around, and Indigenous knowledge, has a role to play, and other forms of knowledge, of course. I put there on this slide a link to the actual statement. This is actually his State of the Planet address, December last year, if you have not come across this address. Myself, I'll be looking at 5 major points. Firstly is to have an understanding of the crisis that we are facing, and briefly look at what is planetary health. Planetary health is defined by a few groups from various perspectives. Briefly look at the state of the planet, and also look at the role of health promotion and planetary health in the world today, as well as our situation here in New Zealand. Then I'll ask a few questions that we can actually look at later on after our 3 presentations, and have a conversation around those questions and others that you might have. Emma, I can see Amanda is in the waiting room.
I'm just going there now. Yep.
Wonderful. So firstly, what is planetary health? Here at the Health Promotion Forum, we define planetary health from 2 perspectives, by combining 2 perspectives. The first one is that of the Rockefeller Foundation Lancet Commission on Planetary Health. The Lancet defines planetary health as the achievement of the highest attainable standard of health, well-being, and equity worldwide through judicious attention to the human systems, political, economic, and social, that shape the future of humanity and the Earth's natural systems. So those are the 2 main aspects of the definition by Lancet. The social reality, the human systems, and the natural reality, Papatuanuku, Mother Nature. The other definition, perspective that we draw from is the Indigenous perspectives that is reflected in one of the 2 legacy statements that the International Union for Health Promotion and Education and the Health Promotion Forum, with 1,000 participants at a 2019 conference, World Conference of Health Promotion, put together. And it's about Mother Nature and the philosophy or the concept that we are one with nature. And Mother Nature is like a being, a living being, a person. And we are interdependent, with Mother Nature. And so we adopt these two frameworks, the Lancet and the legacy statement, because they are not only comprehensive, but they are inclusive of science, of ethics, spirituality, and indigenous knowledge. Williami touched on his faith and earlier on, and we can see that increasingly around the world, uh, faith traditions, religious traditions, their wisdom and their perspectives are now being looked to, as part of the answers on addressing planetary health. And more on that later on. Again, I put a link to our legacy statements from the 2019 conference there for you in your own time. You can have a look at. So moving on to where we are, the state of the planet, our health and well-being. Again, I bring back the statement from the Secretary General, some more details on that. You can see that 1 million species are at risk of extinction. Ecosystems are disappearing, before our very eyes. Deserts are spreading, wetlands are being lost, and every year we lose 10 million hectares of forests. We think of the Amazon and other places around the world. Air and water pollution are killing 9 million people annually, more than 6 times the current toll of the pandemic. Remember, this was his statement at the end of the last year, and there are more and more people still dying, as we speak. From the perspective of the two legacy statements, there are the two statements are the Aotearoa statement. There was the general statement of the conference. And the other statement was the Indigenous participants, the Indigenous people statement from the conference. And that statement, points out the forces of colonization and capitalism and globalization. They are the major contributing factors to the environmental degradation, the climate change, the loss of biodiversity, and the devastation of indigenous communities. And these things have encouraged, the philosophy, the values, and the principles that drive these things have encouraged human activity that actually, accelerates the depletion of our resources, our common resources in our common home, planet Earth. Again, there's a link there for that second legacy statement for you to look at. You can ask questions later on, and we can discuss that. I'm kind of touching at the top of things here. So really, for me, it's not just one crisis. It's not just climate change. It is not just COVID-19. It's actually a convergence of massive driving factors. And the interesting thing here is that they are all human-made. And while it is very challenging to change human behavior, they still hope that we can change. When we look back at history, we have been able to address some of our thinking and our actions that have harmed, humanity. And so those factors are a spiritual crisis, and I refer to the kind of values and principles that have informed our evolution as fellow human beings. Some of those values and principles were working at the time, but not anymore. The way that we relate to nature, the way we relate to each other, as human beings. And because of that loss of values, or perhaps the values that are out of date, we are led into a social crisis. Our identity, we hang on to our identity as race, ethnicity, and nationalism, as if that is the only identity we have, when actually we have moved on to a stage where we have become a global village. And so we need to revisit our values and our principles. and we see the emergence of harmful behaviors of racism, of whether it's personal or institutional, of discriminations, of prejudice against gender, against race, against class, against belief systems, and so on and so forth. And for me, that is the suicidal attitude and the waging war against nature and between us fellow human beings that have led to the environmental crisis, which led also to the economic crisis. We are running out of resources and have led also to the health crisis. As you know, COVID-19 is essentially an ecological crisis. We frame it from our human perspective as if the viruses are trespassing. But the reality is we are the ones who are trespassing the domain, of the animal kingdom, of the viruses and other beings. So we need to revisit our values and principles and consider why are we waging war against each other and our one common home, planet Earth. All these things have led to the crisis that we are experiencing. And as I said earlier, we have come a long way from the family and the tribe to the city-state and into the nation-state and empire. And we are now at the threshold. In fact, we are right into the depth of the planetary stage of our social evolution as human beings. And we need to look at the kind of values and principles that will bring us to work together, to work in solidarity, to collaborate rather than competing. And therefore, we exploit our common resources and we compete with each other and become violent at times. And as a result, we see the big imbalance in the distribution of our common resources. As you know, one figure states that 10% of the world population controls 80 to 90%, of our wealth. There's a huge injustice in that. Another interesting development is that the knowledge systems of the world, are coming together, still competing, but now are beginning to collaborate or acknowledging each other. The knowledge of the West, the knowledge of the East, the knowledge of indigenous peoples. Science has been leading and contributing, but does not, of course, offer all the answers. We need to bring in ethical knowledge systems and spirituality, whether it's based on culture in association with nature, or whether it's based on faiths and beliefs, and religious traditions, as Williami, alluded to earlier. And later on, we will look at how, scientists and others who are working in the sustainable development space are looking to all these knowledge systems. So what we are doing, here's a brief outline of the history of the development of health promotion in its relationship with the environment, which is now planetary health. Firstly, health promotion is present in all culture, from time immemorial. The first textbook on health promotion based on our New Zealand experience that was published in 2019 by Otago University Press, Mihi Ratima and Louis Signal were the editors. I think it's in the first chapter where they co-wrote with John Rayburn, one of the major contributors to the Ottawa Charter, a chapter on the origins of health promotion. So it's basically what I'm saying is I recommend that book for all of us to look at. But as an academic field, it started from Europe, branching off, of course, from public health. And a few decades ago, the focus was health education. changing the behaviors. And then in the 1970s, with the Alma Ata, 1978, this new thinking of considering the context, considering the environment, whether it's built or natural, more seriously, as one of the major influences and contributors to the health and well-being of humanity, and then followed on by the Ottawa Charter, the global framework from WHO 1986. In the Ottawa Charter, it talks about the ecology as one of the 9 prerequisites for the determinants of health and well-being. Also within the 5 strands of the Ottawa Charter, the second action strand is creating supportive environment. That's another acknowledgement of the role of the environment in the health and well-being of humanity. The principal author of that paper that led to that strand is a good colleague of ours here at the Health Promotion Forum, Professor Trevor Hancock. We do some work together these days. But overall, over the last few decades, the public health and health promotion has been largely blind to the importance of the environment. Our focus has been on social determinants of health, what humans cause, to, things like social hazards like tobacco, alcohol, sweet drinks and sugary drinks and all of that. In the Bangkok Charter 2005, spirituality is mentioned there, but not, in my view, substantial enough. And John Rayburn, another good friend and colleague of ours here at Health Promotion Forum, was instrumental in making sure that spirituality is, mentioned in the Bangkok Charter. The Bangkok Charter, of course, as you know, among its few foci was it's on the commercial determinants, of health. The world becoming more globalized and dominated by the corporate sector. But as I mentioned there before, Western health promotion has been largely ecologically, blind. But here in Aotearoa, the mainstream health promotion side of work, influenced by the European development that I mentioned earlier. But for Tangata Whenua, Indigenous, Maori, that is, their approach to life and their approach, therefore, to health and well-being has always been socio-ecological. That is, they understand the place of we humans within the broader context of Papa Tuanuku, of the Whenua, of the Whenua. And the same with the, we folks from the smaller island nations. I say smaller island nations because New Zealand is bigger, but still a Pacific island nation. And between 2007 and 2019, the Health Promotion Forum has been engaging with the largest organization that is advancing the ongoing development of health promotion, the International Union for Health Promotion and Education. And one of the things we did was to introduce and bring not only planetary health into the major focus of IUHPE, but also to look seriously into Indigenous knowledge, not only from Aotearoa, but other parts of the world. And that culminated in a conference that I mentioned earlier, the 2019 World Conference on Health Promotion in Rotorua, and those 2 legacy statements that I referred to for you to look at later. And the theme of the conference was Waiora, promoting planetary health and sustainable development for all. Wayora was purposely put there so to signal to the world that Indigenous knowledge is an important component, not only of the conference and its contents, but also the work on planetary health that we would like to see moving into the future. And last year, we established a global working group on promoting planetary health and human well-being that I mentioned earlier. And this year, we successfully included planetary health and Indigenous knowledge in the strategy of IUHPE for the next 5 years. Earlier this year, we participated at the Planetary Health Alliance conference that was organized out of the University of Sao Paulo. And during that conference, a declaration known as the Sao Paulo Declaration was drafted, had the bounty of contributing to that drafting. And the Health Promotion Forum is a signatory to the Sao Paulo Declaration. There are now a few papers published on planetary health which include Indigenous perspectives from New Zealand. Mihi Radima is one of the authors of these papers. Myself too, we have a paper that will come out at the end of the year, published in the Global Health Promotion Journal. That's one of the two academic organs of the IUHPE. And I mentioned that so that you look forward as participants to that and to have a copy. But also, importantly for New Zealand, IUHPE has accepted our health promotion accreditation framework under its global one system, one framework to include components from New Zealand for our New Zealand use. And that is tertiarity and our social, political, and cultural context in Aotearoa, New Zealand. So it's quite a milestone for our team. It also means a lot of work to be done. But those are the things that we have done in here at Health Promotion Forum, for the ongoing advancement of health promotion for the workforce in New Zealand, and also our contribution to the global level. So what can we do? As I said, now there's an opening for Indigenous knowledge, to be part of the mix, along with spirituality, with science, knowledge of the East, knowledge of the West, now that we are a global village. And as the Sao Paulo, declaration, calls, it calls for Indigenous peoples, faith traditions, artists, entrepreneurs, and to scientists, of course, that everyone, has a place, has a task to contribute to planetary health, to the well-being, of the world. It pays actually to read this wonderful statement, the Sao Paulo Declaration. These are parts of the excerpts from the Sao Paulo Declaration that I just clipped out and to share with you in your own time. You can look through. I'm conscious of the my time. I've gone way more than what I was supposed to be. Again, here's an excerpt from one of the 2 legacy statements and our 4 recommendations. So these are some of the things that are in place already. We have Indigenous health promoters that are very socio-ecological. It deals with planetary health. Same as Duri with Te Pae Mahutonga, of course, 20 years ago, that he introduced that model to the New Zealand health promotion community. And at the conference in 2019, he gifted another model for health promotion, Matariki. And he spoke about, if we combine those 2, we are still able to steer our nation and contribute to the rest of the world and be guided by the stars, stars such as the Matariki clusters. And as he pointed out, our ancestors have been very visionary and strategic, always looking into the future, for the well-being of our nation in this part of the world, and humanity. Here's a contribution from our Pacific community. Here is a model that I introduced 2007 for Noah Ola. It's about the principle of humanity being one with the planet. So some quick examples of what we have done already in New Zealand. So we are actually in the right direction. We have the tools. We are fortunate that we are deep in Indigenous knowledge. Aotearoa guarantees that we use them. If you look at the current health reform, we now have a Maori Health Authority in place, and I think Te Heringa is in the right space and the right time to contribute to those changes. But it's about working together. As you can see, those words there from Dr. Tedros. It's about national unity. It's about global solidarity. Those are the kind of principles that we should look to, to help us in our journey in not only battling COVID-19, but the convergence, those other major factors. Because the world is but one country, and mankind its citizens. We are one village. So some questions for us to look at later on, but I'll pause there and I'll ask Rachel to prepare to go next. So if you have any questions, put them on the chat box and we'll talk about them later on. Over to you, Rachel.
Sorry, I can't seem to get to my slide. Can you all see this? Yes.
Yeah, there you are.
Kia ora tātou, and thank you for that inspiring talk that you began the session with, Sione. So as I said, my talk is going to be reflecting on some of the findings from some research that I've been doing in South India. And I can very shortly explain why I even got into this topic area. But let me start by saying that even though this is the context of Kerala and in South India, I think the lessons that can be gleaned from it that we are relevant from a conceptual level, the way we understand sustainability and sustainable development from a health promotion perspective. And I also think that these are lessons that, as Sione was saying, we are a citizenship across the globe. We are a global citizenry. And these are lessons that would be applicable regardless of where we are sitting at the moment. So I don't think there's anybody in this room who is not aware of the COP26 that's currently underway in Glasgow. We've got about 3 or 4 more days of COP26, and we're all waiting in anticipation for the global leaders, to come up with some solutions to our pressing crises at the moment. And it's been both an up and down journey so far. We're still waiting for the highlight that will lead us out of what we see as a bit of a tunnel to get to the outside of this climate crisis. But health promotion has been very much integral in identifying climate crisis and also trying to find some solutions in an everyday sense of how we might actually manage and change the course of this crisis. As Sione was charting this excellent coverage of the discourses of sustainability within health promotion. Mine is just a snapshot in comparison, but enough to set the context for what I'm going to say in relation to this research that I was doing. So the Ottawa Charter, as Sione pointed out, not only talks about the 5 arms and the supportive environments, but also in its prerequisites, it lists sustainable resources as one of the prerequisites for good health. And if you're familiar with the rest of the text, you also remember that it includes peace as well. So peace, sustainable resources. If we don't have this, we cannot anticipate or expect to have good health. Sione also mentioned Trevor Hancock, who's amongst the earliest scholars, I think, way back in the 1990s, was talking about what he called the ecological determinants of health, almost as counter to or perhaps supplementing the social and economic determinants of health, essentially saying unless our environments are secure, unless our environments are robust and solid, that is going to impact on human health, pointing to the significant overlap between the two. Closer to home in New Zealand, we have also, as mentioned, the Paemahutonga, the Southern Stars, which encompasses a broad range of identity factors, participation, leadership, history. All of that is encompassed into what human health could accomplish, but that sits within an environmental context as well, and the relationship between human and nature, or society and nature. At the scale of other scholarship as well, if you look at health promotion journals, academic journals, there is now a growing body of scholarship that talks about planetary health and how that impacts on human health, moving away from purely a focus on social determinants of health. Also in 2019, we had the Waiora conference, which and a statement from the legacy document was basically acknowledging Waiora as the realization of health co-benefits of sustainable one planet living, again pointing to that intrinsic ways in which human health and sustainability are linked. So what exactly do all of these commentaries point to? That there are overlaps between environment, sustainability, and health. In other words, what is good for the environment is also what is good for human health. Hancock, in fact, goes on to elaborate on some of these linkages, and he says that actually between human health and environment, there is this in-between link there called the economy and capitalism, and which has already been referred to, capitalism and neoliberalism that frames this economy is what is creating the fracture between health and environment, which should otherwise be a seamless connection. And so he calls for a reconfiguration of these the links between these three. That's the three pillars that he calls health, economy, and environment, suggesting that in between this, what holds them together should be equity and sustainability. Now, despite this thriving scholarship, there are also gaps in the literature, and this has been somewhat an eye-opener for me to come to terms with. Much of the excellent conceptualizations that we have about planetary health tends to be at the upstream level. It tends to be at the level of values, at the levels of principles, at the level of conceptual ideas. When it comes to actually practice and application downstream, what it peters down to often is more individualized and behavior-focused applied forms. So in other words, are we eating meat or not eating meat? Do we have a plant-based diet or not? Are we turning off the lights? Do we have electric cycles or something like that? It kind of falls down into these very sometimes important, don't get me wrong, these are important, but nonetheless tend to be these fragmented, individualized changes of behavior and in consciousness of individuals. So in other words, much of what we see as health promotion action tends to be the fostering and creating of a green citizen. So against that background, I'm going to talk about my presentation today is going to be looking at consumption in Kerala. So why consumption at all? Well, like many of the global South countries, India is one of those that has had this rapid acceleration of affluence. Yes, there is poverty, abject poverty in sectors and segments in India, but at the same time, the past 30 years or so, with the opening up of the economy and neoliberalism, there's been a rapid increase in economic well-being. And with the affluence has come escalation, if you'd like, of consumption and consumerism. So I've lived in New Zealand for the past 25 years. And in the past 25 years, every time I went back to India, that's where I come from, I would be staggered at the level of consumerism that we wouldn't have here in New Zealand, but you would have there. It's not uncommon for 3 people to have 4 cars, that sort of thing. and the impact of that, and the systems in place that were absent as part of that rapid growth was something that quite, I suppose, upset me at one level and led me to pick up this research topic. As you can see from that graph over there, today, this is 2019 data, India is the 4th biggest emitter of carbon dioxide. And on the one hand, we think of India as a developing country, but actually it's not its poverty, it's its prosperity that is now causing concern throughout the world. At COP26, India had vowed to great promises to reduce emissions. So, and that has actually lifted the otherwise bleak tone of the conversations at COP26. So let's see how this promise is going to be upheld in time to come. My paper today will focus on some of the barriers to practicing sustainability. Why is it that we are not able to create this green citizen? Why is it so challenging? And in doing so, look at ways in which we can close the gap between the everyday and the conceptual. What is missing between the two? So let me start with a brief outline of Kerala. I'm not sure how many of you have heard of, been to, or know much about Kerala. So Kerala is that little red state at the bottom, southwestern state of India. Again, it's the state that I come from. It accounts for about 2.8% of India's population and covers about 1.2% of its land area. It is the 9th largest economy among the states of India. It's also the most urbanized major state, with at least 50%, nearly 50% living in urban cities and towns. It is also the 2nd least impoverished state in India. A major source of income to its population is through remittances. It's been a huge history of migration, particularly to the Middle East, and people in Kerala have been living off the remittances. In fact, this is one of the aspects that has spurred this consumption drive in Kerala. Kerala has been noteworthy for several things, particularly since the 1970s. It's been known as a Kerala model of development because it's got staggeringly good levels of quality of life in terms of fertility, in terms of literacy, in terms of expectancy, infant mortality. Its population is highly politically aware, and it's got a relatively strong public health system. In fact, we managed COVID in an excellent way. In 2021 with Delta, it's been a different story, unfortunately. Kerala is also the state with the highest consumption in the country. If you look at all the records and estimates, economic estimates, consumption is the highest. And this is the case in urban and in rural areas. In 2018, and also just a couple of weeks ago, there were massive, unprecedented floods. The 2018 floods took around 500 lives. It's been unprecedented, and it never had such a thing before, at least for the past 100-odd years. After the floodwaters receded, and this was again a shocking thing to see, when the floodwaters receded, what it left behind was garbage, plastic bottles just lining the streets, plastic bottles lining the seashore. It was just a shocking sight, showing that this unsettling link between human consumption and the devastation of nature. At the end of after the floods, there was a review done by government, and that quote from the government report is provided there. It says that the government can and should systematically analyze consumption patterns and see how the state's environmental footprint, both locally and outside the state, can be controlled and minimized. So how we consume is very much a part of this narrative of or a reality of how sustainability. So green consumption is very much a part of how the state of Kerala has addressed sustainability and sustainable consumption. At one point, it had this landfill. So basically, people went on consuming and living life as they did, and there would be somebody to take this land and to dump it in the landfill. Interestingly, the people who lived, the communities that lived near the landfill voted. They took a case to court and saying that this is not in my backyard. You can't throw your urban refuse in our backyard. They were worried about the impact on their children particularly. And so that landfill was stopped. which meant that the state had to now rethink how do we consume in a way that does not produce as much, because there is nowhere to actually throw the rubbish that we are producing. So consequently, they started to and have now evolved sort of what they call a devolved approach to waste management. It basically involves focusing on the household as the main and the primary point of waste management. So in a household, segregation becomes absolutely essential, whether you know, how you separate things into plastic, into compostables, into paper, and so there's a lot of work that goes into segregation. And households are also encouraged to buy their own waste management disposal units, whether it's biogas or portable other forms of disposing of your own waste as such. Household waste is segregated into food waste, meat waste, fresh vegetables and peelings that will go into the compost, cans, paper, plastics. And then there are also the non-biodegradable items such as clothes, shoes, bags, and so on. And people quite do not know what to do with it. And this goes in through different sources. Some of it is disposed by the government. Some of it is actually recycled within the house. Some private people take it and upcycle it. So the range of things happen. So in all of this, what the government does, the local state government does, is that it focuses heavily on and invests heavily into awareness raising through the mobilization of communities. This is a language that we understand well within health promotion. So there are educational efforts to improve household waste segregation. There's such things as green teams, green protocols. There are attempts to move towards biodegradable products. Community champions are identified, and women are very much a part of this. So there are what they call grandmothers, green teams, there are homemakers, students, and so on. Technology has been used extensively. So WhatsApp messages telling people, that you have to, recycle, reuse, and reduce, all those messages are constantly, given to them. And there are certain protocols on how you have to live in your local areas and so on. So with all of this, and there's also enforcement models along with education. So the plastic bags were banned, which so now you could, it seems to be universal across. That was done in 2021. Oh, sorry, in 2020 or 2019, and people were getting used to not using plastic bags. It's quite interesting because when I was a 12-year-old, I was living overseas, and I went back to Kerala, and my grand auntie in those days, so I'm talking about the 20, 30 years ago, we asked her, can we bring you something, grand auntie? And she said, yes, we could use some plastic bags. Could you please bring some plastic bags? That was actually a gift in those days, And now we've got such a plethora of plastic bags. We don't know what to do with it in the state. It's causing quite an environmental havoc. So these are some statements from the participants. I won't go into the methodology unless you want to raise it in question answers. But you can see that just looking at the quote on the left, people have very much integrated this idea of environment and personal health. So they say that we avoid plastic tins. We prefer glass bottles because it can be reused and it has no health side effects. We replace aluminium with clay pots, and we use only clay because it is eco-friendly. So health and eco-friendliness are all connected together in the way that people think about their everyday life. Cancer issues are more today because of our lifestyle, which is a consumer lifestyle. We have to be careful so that we do not harm our children's health. And then again, this participant says that using shampoo, cosmetics, all of this is harming our health. So there's a very strong notion of realizing that consumption is creating health, environmental issues, and that sustainability means good health as well. So these linkages are the ones that Hancock talked about is very much prevalent in people's thinking. This set of quotes that I've picked up, I'd ask the people, so why is it that people are defiling environment? Why do they throw their waste and do not dispose of it properly? And on the one hand, looking at all the quotes on the left, and so in the focus groups, they kept identifying self-centeredness as one of the, so in other words, people are just naturally inclined to not caring about anything except their own comfort. People are self-centered. This is the worst thing. Nobody loves or cares for the environment. If the government takes steps to clean it, then it will be protected. Otherwise, no one else will take the initiatives. But when I probed further and asked them, so why are people so selfish? Has it always been like this? And that's when the answers started to really come. And what I felt, and I think this is something that Sione alluded to as well, people are actually quite fractured as a society. So you're talking about a fragmented society. In the olden days, we knew each other's neighbors, but today we do not know anyone because we have all moved into different cities and moved away from our family, our social fabric and our communities. So because of that, there's poor behaviors and attitudes. And this comes because we live in nuclearization, with nuclear families. And similarly, as the other quote says, people in the city have no time for chatting with others. There's just no sense of social cohesion. So urbanization, modernization, nuclearization of families, rapid economic prosperity, all of these have seen to have fragmented social cohesiveness, and with that also the connection to the environment. Alongside, the people also talked about space because they live in the cities. There is no physical space. They can't grow animals. You can't have the cows and the chickens that you have to. So all of this actually lends to sort of a fracture between you, people, and the environment. So that was one of the points that came out from that. And the second point that I'd like to, and the last one I'll possibly touch on, is trust regimes. I asked people, what about plastics? Why do you all use plastics? And people kept telling me, it's not that they don't know. They very well know plastics are bad for them. They said, I am against plastics because it's harmful to people, to the next generation. It will harm us and people and also our children. And the tragedy is that many people burn the plastics that they buy things in because there's no other way to dispose of them. We know the plastic burn is harmful to our nature and to children, but we have no option. I'll touch on that point of this no option and helplessness in a minute. But again, when I kept probing, so why do you buy things in plastic? Why don't you just buy open, things without plastic like we would do from some of our stores? What came out was that really people did not trust what they bought. There was no element of trust. So, and it's not that they didn't know that what they were doing was wrong, but unless they had faith or trust in the food that they were buying, there was absolutely no way that they could reliably buy anything which was not packaged. So in a sense, plastic has become a symbolic surface and a symbol of trust for consumers because it indicates a brand name, it indicates expiry dates, it indicates ingredients and so on. And consequently, despite the misgivings that they have about plastic packaging and knowing that it is problematic, consumers are still continuing to use it because it is the only source of confidence that they have in the quality of whatever they purchase. So it's not that they're practicing or consuming unsustainability. What they're doing is that they're practicing trust. And that is shown through the purchase of brands and plastic. So let me wrap up by saying, this is just, like I said, a snapshot of a wider range of findings from the study, that we do need to think of health promotion actions that move from beyond individual to structural reconfiguration. And structural reconfiguration is actually quite a broad spectrum of things. And it's not just about, do we have windmills, which is important? Do we have electric bikes available? That's important. But we need to start asking questions about social cohesion, about trust, about care, about safety, about belonging. We also need to start asking questions about helplessness, anxiety, and powerlessness, not only from the economy and neoliberalism, which takes away so much of our ability to have control over our lives, but also the pressure to live sustainable lives, which many people just cannot have, or they do not have the power to live sustainably, even if they want to. And that's creating its own anxieties. And it's an area that is often not talked about or studied enough. And finally, I'd like to conclude by saying that conceptually, all of these are acknowledged in the health promotion scholarship, but unfortunately, we do not have enough of the evidence to show how the conceptual practice linkages are forged. And I will stop there. Thank you.
That's a great presentation, Rachel. I know of Kerala. I have colleagues from Kerala, but your map today helped to show me that my geography is very poor. That it's now in the southwest rather than midwest somewhere, but it's very helpful. And I'm struck by the fact that it's second highest urbanized, 50% at least. Wonderful, but wonderful lessons, from your work there. Yeah, great. I'm sure you have questions from the group later on. Williami, I'll turn the microphone towards you. And how are we doing for time? Yeah, we have some 20 minutes or so. I'm sure we can push a little bit, flexible with our time to answer some questions after your presentation. Williami, over to you. Thank you.
Thank you, and it's always good when you're the last one to do the talk because almost everything has been covered, so it's somehow shorten a little bit your talk. But what I want to convince you today, I've come from a very narrow field of practice in clinical medicine to a field that it's far wide, and I think that's a better way to be in if you are more outward focused on the interest of humanity. It doesn't mean that really neglected area in clinical medicine, we still need it, but we need to stem the flow into this area for various reasons, which I will come to. I think at the end of the day, after my talk, we should take the point that even though in a care continuum, the end point from where I am is expensive. There's a lot of death, mortality, and very young as well. And the inequity is quite magnified when we come to that point. So we have to start from the beginning. And the only viable solution I can see is health promotion, because all initiatives that I've seen now, even as advisory to the ministry, I've voiced this, it's not working. Because the figure that we have from the renal unit is nobody can really refute the truth about those figures. In terms of the health promotions, I have some touch on spirituality and Indigenous knowledge. And being Tongan, I think there are two areas that need to be highlighted and to be very much blown up in the health promotion frameworks. And also, as I've said before, the world is so small. We just can't think of health as what we practice in hospital, but what we practice in the whole planet. So in terms of where I am, I'm from Tonga, in a small island in the middle. You can see my mouse over there. I sort of came from Tonga and did 7th form in Nelson College in New Zealand, and then into medical schools. And then as part of specialist training in renal medicine, I spent 4 years in Scotland, in Glasgow, in Edinburgh, and then back again in Middlemore to practice renal medicine since 2005. And from that time up to now, I have observed a lot of changes that come through into renal medicine. This is Middlemore Hospital. At the time I was there as baby doctors in the 1990s, they were all wooden building that was built by America as a surgical hospital, but it is now being a very big hospital. And our program in the renal unit comprises of dialysis patients, those with end-stage kidney disease, that we need to do something about in those two pictures below, either hemodialysis or peritoneal dialysis. We have got 724 patients. Huge. And if you look at the cost to keep one patient alive, the ministry have to fork out 60,000 per patient per year. We have also in our repertoire transplanted patient. That's the ultimate, the best treatment of end-stage kidney disease. Unfortunately, when you look specifically at this population, Pacifica and Maori are overrepresented at 2/3. Middlemore renal unit is the largest unit in the Southern Hemisphere in terms of the people that we care for in the unit. So this is really a report from ground zero. You can look at it that way. So if we look at the first graph in here, that's the total number of people, instant patients, the patients starting dialysis every year. And if you look at it, both Australia and New Zealand, from the start of dialysis in the 1960s up to now, it has been constantly and steadily increasing. More alarmingly is that at the start of dialysis, it's not now a thing of older people. we are having younger people, in particular in Maori and Polynesian. You can see that little curve over here is starting to trend up. It doesn't show quite well in that data, but if I stratified it according to ethnicity, it really shows up, and it's dominated by Pacific and Maori. But what really drives this? What really drives this people to come in? If you look at it, it is diabetes. The effect of diabetes on the kidney, or what we call diabetic nephropathy. If you look at overall in Australia, about a half of those ending up in dialysis unit goes by diabetes. If you look at New Zealand, it's 58 out of 100. But if you look closely at specific ethnic group like Pacifica and Maori, there's about 70 to 80 out per 100. On dialysis, people on dialysis are caused by diabetes, as demonstrated by the two curves, the two graphs below. Now, if you look at people starting dialysis per year and stratify for every confounding factors and corrected for every confounding factors and stratify them according to ethnicity, then you get the real picture. Now, if you look at it, for one Caucasian starting dialysis this year, it means there are 2 Asians starting dialysis this year, there are 6 Maori starting dialysis this year, and there's a 12 Pacific people starting dialysis this year. So there's a huge, huge gap. And one would ask for such developed nations to have such gap. There is something going on in here, and very much so, the question of inequity. Much more so when you look at this, is the comorbidities, the number of disease these people have had while starting dialysis. And you can see coronary artery diseases, the disease of the blood vessels of the lower limbs or the other part of the vessels of the body. The lung problem in people with stroke, they are when hitting dialysis. Sometimes people would say you are more or less like a palliative kind of a care, which is true in some sense as well. So we need to actually look at this and see what else we can do apart from treatment for patching up these people here. So I would say from ground zero, this is a huge cost incurred because of the large number of people starting dialysis. It is preventable. Diabetes, hypertension, it's preventable. The significant comorbidities these people have when starting dialysis lead to early death. And I've seen with my own eyes young Polynesians and Maori dying at the age of 30s, leaving children orphan. And it's very hard in the ward when you're caring. As you know, these young mothers, they start dialysis, and in 5 years' time, these kids, they come to hospital in Miramar, won't have any mum. It really, really hits home. It really, really hit hard on me to have a refocus and reassessment of where I am, really. There's disadvantaged population, overrepresentation of dialysis in Maori and Polynesians. Transplantation is the best treatment. It does prolong life and give you the best quality. But we are again underrepresented in that treatment. And I've mentioned before, equity. As I practice clinical medicine, there comes a time where I have to refocus and see where I am. Sometimes I think of it, I'm just at the end of the cliff in an ambulance, taking them into the graveyard in a very rough ride sometimes. It is expensive. People dying very early on in life. There's an ethnic being hammered, Maori and Pacific. There's inequity. But the tragedy of all of this, it's all preventable. Largely can be prevented if we look at health promotion. Now, Honda in America, I put this in the New England Journal of Medicine most recently, and I think they're spurred on by the COVID-19, wanting to look at the interdependence of us public health and clinical medicine, and want them to be working as complementary rather than a dichotomy where the one work with the others and don't talk to each other. It's time that they need to combine. After all, a lot of the improvement in life expectancy was not much clinical medicine, was public health. This is my view when I get into renal medicine. Obesity is the main problem, really, that causes all that we have in the renal unit. And look at the global warming, bird flu, probably COVID, is something that is not equal. And that's the view probably that clinicians might have in their own little world of practice. They're very focused on a small part of it. So this is probably what my view it is, but if I recalibrate now, it's going to be sort of balanced. So we have to expand, not just stay where I am. And I have to look around, and I have to look around at health promotion, public health. And with my faith, I've mentioned a quote here when I look at the whole totality of human being, is that the earth is but one country and mankind its citizen. No longer I practice in Tonga and the environment able to sustain all that abuse that I have in Tonga because it's only me. There's so many of us. Technology improves. So small an earth is just one country. It's either we unite and bind and work together, or we're probably going to destroy ourselves. So it commands, that reference commands a high degree of unity, peace, and a common good. I can put diabetes in here, in that continuum, and we can go through this. My specialist care in end-stage kidney disease. We can talk about the health system, and you can talk about access into care, GP, specialists, and other specialists. We can talk about prevent obesity in a public health, sugary drink, and all of those. And also we talk about planetary health. So rather than me looking mainly at clinical medicine, I have to look somewhere else. I have to look at the whole picture, because otherwise we keep on building dialysis unit and we can see the magnification of inequity, and some of the population ethnicities will get buried, will get annihilated, really, put it that way. Do we have hope? We do have hope, because we do, as clinicians, have done studies, have shown that if we look at diabetes, not only we can prevent, we can also reverse. The studies, undoubtedly in population studies and also clinical studies, have shown that if you lose weight, one way or the other, you reverse diabetes as an early state. Also, with all those, the reduction in your body weight, if we do it either way, it will prolong your life, even though you are in an end-stage kidney disease. So there's a hope, but the hope is not in medicine, in clinical medicine. The hope still is with health promotions. And even though you can give medicine for blood pressure and diabetes, your overall survival is not very much different. It's only when you lose weight that you can see the significant benefit in terms of survival and other comorbidities. So there is hope. Now, me and Sion, and also a forum of the church leaders in New Zealand, because of that very problems, one of the reasons why we unite is to look at ways in which to reduce the problem that we are facing in our little worlds, in every clinical area, in a hospital. And we come up with this framework for NUA, encompasses everything in the whole planet, in the whole islands, and look at various domains over there. And I think that has been mentioned before, various other framework, but we're looking at implementation in the Tongan community. We're looking at the individual and the family. We're looking at the community. We're looking at institution locally, but you can expand this to be a more looking at nations, looking internationally, not just local. We're also looking at indigenous knowledge. And I think Sione have mentioned that each of us have our own worldviews, very rich. And because we are very close to nature, we have this symbiotic sort of relationship with nature. And it's very important, that worldview. The spirituality as well, to me, is very important in all of this. As Rachel mentioned from India, we need to be more outward focused. We need to look at the well-being of others, not just our own. We need to look at the common good. We need to look at equity. We need to look at justice. We look at peace and security. We need unity. I think if you take all of this and put it in every individual, in every community, in every politician, in every institutions, we are probably there. But it's difficult. But we just can't sit here and do nothing, I suppose. And I think health promotion is a way forward that will go in a long way to actually solve some of the problems that we have. I've come back to the summary that I've said at the beginning, but I want to end this with this, that the well-being of mankind, its peace and security, are unattainable unless and until its unity is firmly established. It is a profound statement, the two statements that I've said today, and very much relevant. It seems to be far-fetched, but what's the alternative? Thank you.
Thank you, Viryami. That was another excellent presentation from the theater into the world as our sphere of operation. And you shared your story, your journey, and your conviction that the answer, some of the answers are in health promotion. And you don't want to sit there as the ambulance at the bottom of the cliff anymore. You'd like to make a big change. And some of the things you mentioned also relate to what Rachel was identified, the importance of values and not self-interest only, but be more outward focused. I like your diagrams from others that you share, but also you reword those diagrams. It's great sharing that. I'm conscious that we are just 12:30, but with the permission of the participants, if you wish, we can stay on for another few minutes, perhaps 10 to 15, and answer some questions or your feedback, your comments on the presentations that we have all shared with you.
I have a question here from Misha. Misha's question is directed at you, Rachel. So Misha's asking, says the concept of trust is really fascinating in your research, Rachel, which is based around consumption. How do you think that the concept of trust translates to health promotion in New Zealand when it comes to major public health topic areas like alcohol consumption, nutrition, immunizations, etc.?
Thank you, Misha. That's an excellent question. In fact, the whole concept of trust has become central to the anti-vax discourse, hasn't it? Why are we not getting our vaccinated, or why are certain people groups not getting vaccinated? And trust is certainly an issue in that. Of course, the term trust itself can be broken into several parts: trust towards the government, trust within systems and public health systems. And if I may even take it further, it tells us and reinforces to us that health promotion does not occur at the level of the individual. It occurs at the level of the institutions, how our democratic systems are in place. If we trusted that the water that we drink is safe, and we just knew that without a question, we would live differently. When we feel that we do not have trust in the institutions around us, we then start to think inwardly, using Williami's words. So yes, I think trust is important, and there are different types of trust. It's both a political concept, but it is experienced at the personal level and how we respond to the world. Thank you.
No more questions from the floor. If anybody has any questions, feel free to put them on chat, but otherwise, nothing at the moment, Sione.
Yeah, thank you, Lavinia. The presenters might have questions to the participants, or vice versa for that matter, or not just questions, but comments and feedback. You know, what are things you find interesting and you'd like to take away?
I'm curious to know if anything that I've said in the context of South India has resonated at all with New Zealand. And of course, trust, as Misha pointed out, is one element, but is there anything else that I'd be quite interested to know whether it strikes a chord for anyone?
I think the concept you talked around, that sort of that green citizenship, or that idea of the individual focus versus more broader, is something that we kind of wrestle with quite a lot. I think it's really easy to think, oh, I've got compostable earbuds now, I'm saving the world. But really, it's not going to do that much.
So then really it is about seeing how we can turn action, health promotion action, I suppose, at the institutional level and upstream. Yeah, thanks.
Yeah, which is something that we're really keen to explore here at Te Ranga Hauora.
Indeed.
It's all about behavior change, right? How do you influence behavior so that it feels organic rather than legislative? How do you influence people's minds to think differently about consumption and reuse and the materials that we use?
I would reframe it as, I think people already know these things. They are unable to, they're constrained to. And so it's about changing the context around them so that they can actually act freely. I think people care about their health. I think people care about the environment's health. I think they see those connections. It's just that they're unable to do anything about it.
And if I may,
I think one of the forums to have this is to formalize it in our education process. And I think one thing I've asked the ministry with regard to COVID is that a lot of mistrusts of this, because they haven't got the basic knowledge, they rely very much on what comes out of the social platform nowadays. For us in Tonga, our information came from the doctors and nurses, but now they get it from Facebook, from everywhere. Why don't we formalize some studies and some simple immunology and vaccination principle in year 9 and year 10 of science? And it's something that you do likewise, so important, and try to put it in the curriculum of the school. I think the kids will like it. I think starting Planet Stupid and March, I don't think is relevant nowadays to what we're living. I think there's a lot of curriculum redundant with regard to how useful it is to us in this planet. And it needs to be thrown out and have something more relevant, such as what we've talked about today.
And so within the 5 strands, you have the 4th strand for action in health promotion, developing personal skills. And that's the role of education and to a great extent, social marketing and all of that. But if I go back also to the original question, how do you change behavior? Firstly, for me, behavior is important, to look at and to examine and to see how it can be changed, but that is not enough to look at individual level only. We need to look at the environment. And when we say environment, we look at both the human systems and the natural system. The natural system is the ecology, the natural state of the planet. The human system is our economic system, our political systems. The values therein, the thinking that inform those structures and how they come into place. It's very clear, as reflected by the Sao Paulo Declaration, the Ottawa Charter, and the two legacy statements, that the dominant economic system in the world today is not working. It's promoting self-interest, consumption, and competition to the degree that we accumulate wealth at our own peril. And a huge imbalance in the distribution of wealth. And so people are coming up with alternative economic models of the secular economy, the donut, framework, the well-being economy. The next World Conference on Health Promotion of the WHO next month, organized out of United Arab Emirates. The theme is planetary health and well-being and inequity. And for the first time, well-being is going to be central to this series of health promotion conferences that the WHO has been running. It is the same series from which Ottawa Charter came out in 1986, and Bangkok Charter and other charters, of course, as we know. But it's also interesting that they observe that certain nations are moving away from economic well-being, GDP only, and look at the broader concept of well-being. New Zealand is in the lead. Some of you are familiar with Sir Michael Mahmood's work on the Commission on the Social Determinants of Health. Michael Mahmood was one of the speakers at our conference 2019. And he contributed, his moving, broadening from social determinants to ecological determinants, some work that he did with Professor Frank Baum in Australia. These addresses are actually on our YouTube channel. You can go to and have a look. And in the process of preparing up for the conference, I mentioned in passing to him where New Zealand was then, looking at adopting well-being as our framework, not just for our budget, but the broader framework of this current coalition. And so he did his homework and shared, his perspective on that on the conference. And it's interesting that 2.5 years later, the WHO is onto it as well. And I think also what Williami said earlier, it's not just the individual, but also the community, the collective, because we are social beings. As Rachel mentioned earlier, we used to be connected to each other and we work together. We know our values. We know who is who in the village. We understand nature and all of that. But not anymore. We are fragmented. And so the third stakeholder, the third protagonist that is important here is the institution, the public institutions, the government, the education system, professional organizations, the corporate sector, the commercial determinants of health, very, very important. We have to work together to address what we are looking at. And it reminds me of what Michael Sandel from Harvard says about where we are today as a society. We are not just a market economy. We are actually a market society. It's the market values that are dominating our lives. And increasingly, everything is shaped up and valued according to its monetary value rather than its intrinsic value that are entrenched within. Yeah, all those things. That's a long answer to any that question. I think Viryami put up his hand. Viryami, would you like to ask a question or a comment before we wrap up? Viryami, Lavinia.
I have another question here from Tanya.
Tanya.
She's actually has to go to another hui, but her final comment she writes is that we need to listen to youth. So she says they're yelling for change and have lots of solutions, but they keep getting sidelined by those of us currently holding power. So that's just her final message from Tanya. It's a good point.
We agree. And we are borrowing from their future. We are borrowing from their future, and we owe a lot to them.
I'd just like to add, if I could as well, I think I completely agree that health literacy is going to be so important as we move forward. And the idea of behavior change is about influencing hearts of minds. I think on an individual level, people have belief and connection. I think it's more a structural change, a system change that will enable more holistic and sustained change in this space. So looking at our determinants of health and being really courageous. And as Tanya said, ensuring that we have youth leaders standing side by side, holding the power, sharing the power. I think that for me is kind of how we're going to move forward and create a better world tomorrow for our youth, for the next generation. Thank you so much for today. It's been wonderfully insightful. Really appreciate everyone's presentations. Thank you.
Thank you, Robin. Rachel and Viryami, any final words from you and we finish? Over to you, Rachel, first. Any final gem of wisdom?
Just to say that when I came into this to the network meeting today, I had no idea who was going to be here, and I had no idea which audience I was speaking to. But it's incredible that even in just this short time that we've spent online, not seeing each other face to face, we've already identified shared values, what we want to achieve, and also there's something almost like a resolve. Oh my goodness, this makes sense. So imagine if we could take this to larger audiences and actually build that connectivity. So we talk about fragmentation and replacing it with connection. This is the first place we start, I think, and we should keep this growing. So thank you, Sione, for organizing this and to Health Promotion Forum. And I think this is certainly a space that must be moved and promoted actively, because I think this is where our future lies. So thank you all, and thank you for great talks from both of you as well.
Yeah, thank you, Rachel. Viryami, any final word from you?
Yeah, thank you all for being here and asking me to present. I think I've got a more wider picture now in terms of looking at planetary health. But I think what really struck me every time I present is unity, our ability to bind as human being and work together. And I think so powerful, that unity, we can do lots of things. And COVID-19, imagine if we're just one country, if all nations cooperate, we all go to lockdown for 1.5 months. Everybody supports each other. We come out of that, all solved. Instead, we're running around lockdown and vaccinations. Unity, it is. Thank you.
Yeah, thank you, Viryami. And same message as I mentioned before from the Director General of WHO. It's a national unity and global solidarity. The challenges we face are no longer about germs and viruses and diseases. It's more about the economic and the political system, and the societal fragmentations that we are facing. And once again, thank you very much, everyone, for participating. And my gratitude, and I'm sure on your behalf, to Rachel and Viryami for their wonderful presentation. Stay safe and keep in touch with us. There will be more webinars, I think one more towards the end of the year. We're only 4 weeks away from the end of the year. I know that Dr. William Puloka, who was here earlier, is organizing his final webishop for the year. So feel free to join then. Until then, wish you all the best enjoy your holiday if you have one, and we'll see you in the new year. And thanks to the team from Promotion, Lavinia and Emma, for participating and also organizing this. Ka kite. Thank you, everyone.